I can't even
Dae'Qauwn
get
Landrum.
I
There
can't
you go.
even get Smith.
Well, that's
right.
what it says right here. It says it right here.
Oh, good for you.
Yeah, okay. Well, let's see. You are with Center Path Wellness in Union County, New Jersey. That would be Plainfield, which nobody in northern New Jersey really knows where Plainfield
Frank
is.
grew up in Bergen County.
Yeah, so it's like there was never any reason to go to Plainfield. Well, maybe there is
Well,
now.
now
but-
there is.
Yeah, now there is.
No,
But
wait a second. Where is Plainfield? I don't know either.
what is Plainfield near? What exit is it? What?
Yeah, what
There we
exit?
go. You know
Wait a
you're in
minute, that's-
Jersey when they
it's
ask for the
It's
exit
a Parkway exit, right?
Yeah, it could, well, if you can go on Highway 22,
Okay,
and that leads you directly into Plainfield.
that's right. See, 22 was the lost road.
It's going to be a lost interview
right
if
by
you don't
Union. You get on that,
All
or
right.
287. You can come
All right,
off
let's
of that.
let's not get
I
into
used to buy fence posts
All
down
right,
there,
Jersey
Taylor. That's
boy.
why I know.
All right, Jersey boys.
Okay.
Well, I learned something new today already.
There you go.
Yeah.
Well, I'm going to teach you something new. Dae'Qauwn is Center Path Wellness. Tell them, first of all, what that is, because you're the program director, correct?
Yes, I'm the clinical service director at Center Path Wellness. And what the organization is a community mental health agency, and we provide services to a diverse amount of people in New Jersey. We serve over 700 clients around either in Plainfield, New Jersey, or around just the local areas, providing mental health services. And so what that looks like is we have 3 different programs. We have an outpatient adult program. We also see children ages 12 and up, and we have a medication management or monitoring program, and we also have a partial care program as well.
And you do telehealth.
Yes, absolutely. So our goal as a part of being a community mental health agency is making sure that we increase the accessibility to mental health services. And so that means that we need to offer telehealth services for people who either are unable to make it because of lack of transportation or they don't stay in Plainfield. And so that's our way to make sure that we provide services outside of just Plainfield, but over the entire New Jersey.
Yeah, and it is something I guess you can do, because it's a visual thing more than a physical thing when you're dealing with mental health.
Well, actually,
but I'm looking at some of the statistics here, which
Yeah.
I think are alarming. The way you have it listed here, it says that in Union County, 27.7% of adults and 20.1% of adolescents in Union County report grappling with anxiety and depression.
This is all since the pandemic.
An alarming 7.1%, I guess, of those of adults fall victim. Is it of total adults fall victim to suicide? No, just of those in that category, right?
Yes, that's correct.
Yeah.
Yeah, so I'm
That's
telling you, the
pretty
pandemic sparked
amazing.
a lot of this because, yes, maybe because we've kind of shed a light on mental illness. We know that we had a senator recently make a derogatory remark about that.
Yeah, we know that, Taylor.
Yeah,
So,
but this is why
this
you
is New
shouldn't.
Jersey.
This is why you shouldn't do that, because this is a serious thing that's going on in this country.
Yes.
And people need to seek help at the right place before you become one of those statistics.
What I find with people trying to seek help, and you have a wonderful facility here, how long does it take the average person if they need help and they need to get to a counselor? What is your waiting list at this time? I know I tried to help somebody the other day here in Orange County, and it was a 3-week wait in order to get help. What is the help? How long does it take to get in?
Yep. So for us, anyone that's looking for services at Center Path Wellness, they can call in today. And what happens is they'll get a pre-intake today, and they'll be scheduled today for an intake as well.
Wow.
So you call in. Yeah, so we have a quick turnaround because we know that post-pandemic, what happened is a lot of people, they need mental health services. Also with the season changing as well. So, just this past weekend, it was just raining a lot. And so we know that weather changing causes depression, anxiety, loneliness. And so therefore, we know that that season change can increase or exacerbate mental health symptoms as well. And so, so our turnaround is just very quick. So you call in today, for example, or one day, you get services immediately.
Well,
Now,
the good news
do you have to be a resident of that area to qualify?
Nope. As long as you stay in New Jersey, you can receive services.
So you have
we accept Medicaid as well, Medicare. different type of commercial insurance, and we also provide services to people who don't have insurance as well.
The fun thing about New York State is there'll be a 3-week wait to get in to see
you're lucky.
if you have a mental issue, but the Undertaker will see you that same hour. If you kill yourself, they'll be there in an hour to take the body away.
Absolutely.
Very sad when you think about it that way.
It's a fighting uphill battle
It
right
is.
now. We have the Commissioner of Social Services and Mental Health on the air with us, Darcy Miller. And it's just gotten so exasperated because of the pandemic. It seems to have brought out the worst in everyone.
Well,
and a lot of it had to do with separating socially.
No, but there's more than that too, though. I mean, pandemic is just one of the things, right? You got people involved in politics going nuts right now. You got the fall with the darker earlier. You got people with anxiety over the holidays and people that have lost people this year that now are thinking of the holidays coming up and that empty chair sitting there at Thanksgiving and all that crazy stuff. So there's a lot of things that are depressing to people this time of the year as we go on. Our summer vacation, our summer warm weather is behind us. And here we go. Let's get ready to start shoveling snow. So I guess, if you have issues, this is the time that they will be exasperated. So your facility in Plainfield, well, like you said, you can do a lot of this through the tele work and everything. But when people come in, you have a pretty good-sized facility, or what's it like down there?
Yeah, we have a good facility. They can come in and they can also, ask to receive mental health services in person. So the telehealth is just an option, but we know that some people need that face-to-face contact as well. And so for those people, they can come in, they can schedule an appointment, and that, again, is on the spot.
Do they need a doctor's referral to get this service?
Nope, they don't need any referral. What happens is during that intake process, they'll see one of our qualified mental health professionals, and then they'll, at that time of the intake, be able to do the intake, provide a diagnosis, and get them in to see a psychiatrist as well to get a psychiatric evaluation. And if they need medication, then the prescriber will do that. If not, they can go directly into our outpatient behavioral health program.
Now, is any of this covered with health insurance?
Yep. So, again, we accept Medicaid, Medicare, some commercial insurance, and then for those who don't have insurance, we don't want to discourage anyone from seeking help because we know that can happen as well. So we accept people who don't have insurance as well.
So if you don't have insurance, you will accept them? It's not automatically, is there any qualifications, or do you just say, I don't have insurance, and they're allowed to come in?
Yep, they said that they don't have insurance, and then what the administrative staff does is they put them into a system, and then they still receive the same services as well.
It sounds, now you talked about you can prescribe medication also there, which a lot of places you go to now you cannot get medicine prescribed. So you have actual psychiatrists who can prescribe.
Yep, we have psychiatrists and also advanced practical nurses who can also prescribe medication, because we know that some people are okay, they're able to function by themselves. They don't need to actually see a therapist, but they do need somebody to help them monitor medication, and so we do that as well.
Do you also work with drug counseling where people need, the counseling for drugs, or do you refer that out?
Yeah, so currently we refer it out. We don't accept any clients who have a primary diagnosis of substance abuse. But if you have a mental health diagnosis that's primary, meaning that that's your main concern, and then you have a substance abuse that's secondary, where maybe you are participating in some type of other substance abuse program, like maybe an AA or NA or some type of like Suboxone program or something like that, you can still receive service with us for mental health. But right now we're not accepting anybody for substance abuse, but that's on the way.
All right, so we're speaking with Dae'Qauwn Landrum, and if people would like to find out more about Center Path Wellness over there in Union County, over there in Plainfield, where would they go?
Yep, so they can contact info@mycenterpath.org, or they can come in, or they can call 908-756-6870, extension 600, or they'll feel free to come into the office, which is located at 117-119 Roosevelt Avenue in Plainfield, New Jersey.
Well, really very important work you're doing. You don't know how many lives you're saving every day. And the point is to make sure the stigmatism is gone from mental health, because that is the reason a lot of people don't seek help. We've seen it so many times. And we're trying to eliminate that stigmatism, just like any disease that people have. You go to a doctor to get help. So that's the biggest point of all this, that there's no reason to feel ashamed or embarrassed by this.
No.
Get help.
And get help. And, it could be something that you've never had this problem growing up,
Right.
but all of a sudden something triggers it. There's a lot of things we go through in life that trigger things. It could be a
Absolutely.
death in the family. It could be a health issue.
A
It could be
divorce.
anything like that. And if
Right.
you're feeling like just not right, get help and get on the right path, and you'll do much better beyond that. So thanks for coming on
Thank
the
you
air with
very
us.
much for everything you do also.
Absolutely.
No problem. Thank you all for having me. I appreciate it.
Anytime.
Take care.
Bye-bye.